This is a tutorial on the peritoneal cavity. So the peritoneum is a thin serous membrane which lines the abdominal cavity and a lot of the viscera within it. So it's kind of similar to the pleura and the serous pericardium. So a serous membrane is one which produces serous fluid. So we're looking here at a model of the abdominal organs. And what I'm going to do is I'm going to take a cross section right down the middle here, and so I'll just switch over to a diagram and we'll talk about the peritoneum and the peritoneal cavity. So we're just going to slice right through the liver, the stomach, the pancreas behind the stomach, the colon, the intestines, the rectum, the uterus and the bladder. So we're looking here at the sagittal section, which I just described to you. So we've got the liver at the top, we've got the stomach that we've sliced through, the transverse colon, the small intestine, one of the loops of the small intestine. We've got the sigmoid colon, rectum down here, the uterus, and the bladder at the bottom. So the peritoneum is this membrane which surrounds the abdominal cavity and the abdominal organs. So the bit which surrounds the abdominal cavity is called the parietal peritoneum. And what you've got to remember is that the parietal peritoneum and the visceral peritoneum are at one continuous sheet. They're not separate things. This is what confused me when I was learning about it. So the parietal peritoneum lines the abdominal cavity. So I'm going to draw this on in red. So I'm drawing on the parietal peritoneum. So we've got the parietal peritoneum in red, and you can see it lines the outside, so it sits on it lines the abdominal cavity. And then where the peritoneum surrounds the viscera, so the organs within the cavity, it's called the visceral peritoneum. So I'm going to draw this on in blue. So now we've got the red parietal peritoneum and we've got the blue visceral peritoneum. So it's one continuous layer, but where it surrounds the organs, it's called the visceral peritoneum. So there's a potential space between the parietal peritoneum and the visceral peritoneum, and this is called the peritoneal cavity, and this contains peritoneal fluid. So you can see in this red shading in this diagram and this blue shading, this is the peritoneal cavity. So it's this potential space between the visceral peritoneum and the parietal peritoneum. So the peritoneal fluid contained in this space inside the peritoneal cavity helps to lubricate the movement and expansion of the gut. So you can see there's also these double folds, so where the visceral peritoneum doubles up, so you can see between the liver and the stomach there's this doubling up of the visceral peritoneum. It's given a special name. So the doubling up of the visceral peritoneum between the stomach and other organs is called omentum. So you've got a greater omentum and a lesser omentum. And where the visceral peritoneum doubles up around other organs and attaches it to the posterior abdominal wall, it's called a mesentery. So you can see this doubling up of the visceral peritoneum surrounding the transverse colon and attaching it to the posterior abdominal wall. And you can also see it surrounding the small intestine and attaching it to the posterior abdominal wall. This is called a mesentery. So it's important also to understand the difference between a retroperitoneal and an intraperitoneal organ. So an intraperitoneal organ is an organ that is almost fully covered by a layer of visceral peritoneum. And these organs are not actually, there's no organ which is actually inside the peritoneal cavity, but some of these organs are suspended by mesenteries or by the doubling up of the visceral peritoneum. so that they are inside, so that they're kind of within the peritoneal cavity, but they're not truly within the cavity. So the cavity, the peritoneal cavity, lies outside the visceral peritoneum, between the visceral peritoneum and the parietal peritoneum. So the intraperitoneal organs are just wrapped entirely in visceral peritoneum and suspended into this peritoneal cavity. So you can see these organs, which are suspended by mesenteries from the posterior abdominal wall, are completely encapsulated in visceral peritoneum and suspended into the peritoneal cavity. But they are not literally within the peritoneal cavity, if that makes any sense. So retroperitoneal organs are organs which lie behind the peritoneum, or just have one surface covered by peritoneum. So you can see the pancreas here and the duodenum. So these lie behind the peritoneum. So they've got only one surface covered by the parietal peritoneum. So they are called retroperitoneal organs. So intraperitoneal organs are completely or almost completely surrounded by visceral peritoneum, but the retroperitoneal organs only have a part of their surface covered by peritoneum. So the peritoneal cavity is divided into a greater sac and a lesser sac. So remember I mentioned omentum. There's a lesser and a greater omentum, and the lesser omentum connects the lesser curvature of the stomach to the porta hepatis of the liver. So this bit here, this double fold of visceral peritoneum connecting the liver to the lesser curvature of the stomach is called the lesser omentum, and connecting the greater curvature of the stomach to the transverse colon is this fold of peritoneum called the greater omentum, and this loops down over the small intestines and curves back up to attach to the transverse colon. So behind the stomach and the liver, and shaded in blue in this diagram, is the lesser sac. So this is a part of the peritoneal cavity which lies behind the stomach and the liver. And the greater sac is the larger part of the peritoneal cavity and makes up most of the cavity. So this is shaded in red, and this starts all the way up at the diaphragm. So you can see this bit of shading in red above the liver. So it starts above at the diaphragm and extends all the way down to the pelvic cavity. So that's the greater sac. So next what we'll do is we'll take a look in a bit more detail at some of the peritoneal attachments, and we'll trace their path through the peritoneal cavity so we can get a better understanding of where these attachments are and what organs are retroperitoneal and which organs are intraperitoneal. Okay, so we've talked about a little bit of the basics of the peritoneal cavity and the peritoneum, and what the visceral and parietal peritoneum are, and the divisions of the actual cavity, so the greater and lesser sacs. So now we'll just sort of have a guided tour through the peritoneal cavity. We'll start off at the liver and look at some of the peritoneal attachments in a bit more detail. So I'll start at the top and we'll work our way down. So the liver has various ligaments which attach from its surface to the diaphragm and also to the anterior abdominal wall. And these ligaments aren't like ligaments in joints which connect bones to bones. These ligaments are folds of peritoneum and they anchor the liver into place. So the liver is this organ here in the right upper quadrant of the abdomen, and it sits just underneath the diaphragm like this. So we'll just take a look at some of the peritoneal attachments of the liver. So I'll just isolate it and I'll show you some of the ligaments that we have. So we're looking at the anterior surface of the liver, and we've got a ligament which separates the right from the left lobes. So this is called the falciform ligament. So I'm drawing this on in yellow, and this runs up the middle of the liver. And this ligament attaches the liver to the anterior abdominal wall, so attaches it to the inner surface of the rectus sheath. So it attaches behind the rectus sheath as low as the level of the umbilicus, and it's a remnant of the umbilical vein of the fetus. So in its base, so at the base of this ligament, the falciform ligament, in the free margin you've got a ligament called the round ligament. So I'm drawing this little round ligament on in blue. So that's contained within the falciform ligament in the free margin at the base of the falciform ligament. And the round ligament passes into the groove between the quadrate and left lobe. So remember, above the liver you've got the diaphragm. So I'm drawing the diaphragm on here. So this is the diaphragm in red. And reflecting off the diaphragm you've got folds of peritoneum. So these folds of peritoneum reflect off the inferior surface of the diaphragm and attach onto the liver. So you've got these reflections from the inferior surface of the diaphragm which reflect onto the liver. So this ligament here is called the coronary ligament, and you've got upper and lower coronary ligaments. So this one here is the upper coronary ligament. So you'll be able to see the lower coronary ligament or posterior coronary ligament on the posterior surface of the liver. So where the anterior and posterior coronary ligaments meet, you get the triangular ligament. So you get this triangular ligament at this side. So here is this side is the left triangular ligament, and on the other side you've got the right triangular ligament where the upper and lower coronary ligaments meet. So what I'm going to do is show you a diagram to make this a bit clearer than my silly scribblings. So if we rotate the liver round, we're going to take a look at the superior surface of the liver. So imagine looking at this view. So we're looking at the same view I just showed you in the 3D model. We're looking superiorly at the liver. We've got the right lobe here, left lobe on this side. We've got the inferior vena cava posteriorly. And you can see the ligaments that I drew on before. So you've got the falciform ligament coming up here, separating the right and left lobes. And it goes off to attach to the anterior abdominal wall. And then you've got the coronary ligaments, which come down from the diaphragm, and then you've got the left triangular ligament and right triangular ligament. So just coming back to this 3D model, so we're looking at an anterior view here. What I'm going to do is we're going to rotate it around to the back, and we'll look at a diagram of the sort of posterior and inferior surfaces of the liver. So we're looking at the inferior and posterior surface of the liver, and you can see the coronary ligament here. So this is a reflection of peritoneum which attaches the diaphragm, the inferior surface of the diaphragm, to the liver. So you can see the coronary ligament here running round, and then at the bottom you can see this lower part. So this is the lower part of the coronary ligament, which you can see on the posterior surface. So this coronary ligament demarcates an area of the liver which is non-peritoneal. So there's a bare area on the liver where there is no peritoneum. So this is called the bare area of the liver. And this part of the liver is in direct contact with the diaphragm. So the right triangular ligament is formed in this lower extremity of the bare area of the liver, where these two layers of the coronary ligaments fuse, and this right triangular ligament passes to the diaphragm. So the peritoneum covers the whole liver except for this area which I'm showing you at the back of the liver, called the bare area. So the majority of the liver is covered in peritoneum, which reflects off the diaphragm. And then you've got this fissure here, which is called the fissure for the ligamentum venosum. So the ligamentum venosum is a fibrous remnant of the ductus venosus, and just below it, so just here on the side of the quadrate lobe, you can see the where the round ligament comes into the back of the liver. So remember I showed you the round ligament passing in the sort of margin of the falciform ligament. It passes to the posterior surface and runs along here. So from the ligamentum venosum and the porta hepatis, you get the lesser omentum, which connects the liver to the lesser curve of the stomach and to the first part of the duodenum. So the peritoneum, which encloses the liver, meets to form this double layer of peritoneum at the porta hepatis, and it connects the porta hepatis to the lesser curvature of the stomach and the first part of the duodenum. So this is called the lesser omentum. So which organs are intraperitoneal? We've got the liver, the spleen, the stomach, the first part of the duodenum. We've got the jejunum and ileum, so all these loops of intestine. Then the transverse colon is obviously intraperitoneal. We've got the sigmoid colon, which is intraperitoneal, and the superior parts of the rectum are also intraperitoneal. So the retroperitoneal organs are the kidneys at the back, so you can see the kidneys here, and the adrenal glands which sit on top are retroperitoneal. We've got the head and the body of the pancreas, which are retroperitoneal. The tail is actually intraperitoneal. And then we've got the second to fourth parts of the duodenum, so the bits between the duodenojejunal flexure. So we've got the second to fourth parts of the duodenum, which are retroperitoneal. And then you've got the ascending and descending parts of the colon, which are retroperitoneal.
Okay, we're now going to talk about the peritoneum and answer the what questions. What is peritoneum and its parts, peritoneal fluid and mesothelium? What is the difference between intra and retroperitoneal organs, and what provides innervation and vascular supply to the peritoneum? Hello everyone, my name is Dr. Morton and I'm the noted anatomist. So here we have in this schematic a picture of the trunk, and the orange line represents the diaphragm, and above the diaphragm are three serous sacs. We have the pericardial sac containing the heart, and then flanking either side of the pericardial sac are two pleural sacs, both containing the lungs, and below the diaphragm is the peritoneal sac engulfing abdominal pelvic organs, and that's what we're going to talk about. And so the abdominal pelvic cavity is lined with a serous membrane called the peritoneum. And the peritoneum completely or partially lines the internal surface of the abdominal wall and organs of the abdominal cavity. So let's do some discussion of some of this jargon. So first of all, what is a serous membrane? Well, serous membrane lines the wall and organs of a body cavity and makes serous fluid. So this picture shown here is a cross-section through the abdominal cavity. So that's the serous membrane we're going to talk about. And so in pink, there's the serous membrane lining the abdominal cavity, and it makes fluid. And because this is the abdominal cavity, it's going to be peritoneal fluid, which then goes within the peritoneal cavity, the space or cavity within the serous membrane, and fills it. So what's mesothelium? Well, if we now take a little section like this, like that, and blow it up, that's mesothelium. It's the tissue that comprises the serous membrane and makes the peritoneal fluid that goes in the peritoneal cavity. So what is peritoneum? Well, Greek for peritoneum means stretched around. And so a peritoneum is the serous membrane that stretches around or lines the abdominal cavity, and it's made of mesothelial tissue. So there in blue, we just outlined, or the lining of this serous membrane that stretches and wraps around the inside of the abdominal cavity and organs. Well, the peritoneum is like a fist in a balloon. So there's a balloon, and inside the balloon is air. And outside the balloon, or lining the balloon, is plastic. And there's a fist. Now watch. Shing, shing, shing. I'm going to ask a question. Is the fist in the balloon? And the answer is no. What the what? Because what happens now is we see that inside the balloon is air. But look, if we trace along the outside of the balloon and see the fist going inside, the fist is not in the air. The fist simply pushed in the side of the balloon and is covered in plastic. Okay? So the peritoneum is like a fist in a balloon, where there's a balloon and there's the peritoneal cavity. There's a fist and there's the GI tract. And so if we then do this, shing, 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 notice that the following. Is the GI tract in the peritoneal cavity? The answer is no. Why? Well, there's our mesothelial tissue lining the outside, and the mesothelial tissue, you'll notice, and then notice the peritoneal fluid. The GI tract is not in the fluid. The GI tract simply pushed in the side of the peritoneum and is covered in mesothelium, much like a fist in the side of a balloon. So what is peritoneum? Well, there's our peritoneal cavity filled with peritoneal fluid, and the parietal peritoneum forms the wall, and the mesentery, this double membrane, and the visceral peritoneum that lines the organs. And all the parietal peritoneum, mesentery, and visceral peritoneum are all continuous with each other. So what's the difference between peritoneum and mesothelium? Well, distinguishing peritoneum from mesothelium is like clothing. In a sense, you can classify a t-shirt in two ways. You can say, hey, what's that made of? Oh, it's made of cotton. And what is the name of that cotton? Well, we call it a t-shirt. Well, the same way, you can classify the peritoneum in two ways. One by material and say, oh, that's made of mesothelium, or by this name, which is peritoneum. Okay, so now let's talk about this peritoneal sac that has the following three components: parietal peritoneum, mesentery, and visceral peritoneum. So the parietal peritoneum, and the word parietal means wall. It's the part of the peritoneal sac that lines the wall, and it's in contact with the abdominal pelvic wall there in blue. And it's going to be innervated by somatic. We're now going to talk about the mesentery, which mesentery means middle. And the parietal peritoneum, when it comes around, it reflects off the posterior abdominal wall as a double membrane, like that. And it transports vessels and nerves. So we look at this other cross-section in this schematic, and you see arteries and veins, nerves and lymphatics, and they're coursing in this double membrane from the posterior abdominal wall into the gut tube, into the GI organs. Now, the visceral peritoneum, it lines the intra-abdominal organs in the intraperitoneal space. It's also known as a serosa. So there you have it in green, that's surrounding. And so when you take a look at pictures like this often, and you see, oh, mucosa, submucosa, the muscularis externa, and then the serosa, or this of showing the small intestine, and you see all those layers, whenever you see this term serosa, that's synonymous to the visceral peritoneum that we've just been talking about. Now, the peritoneal fluid, that's it there inside the cavity, and its function is to lubricate the surface of organs. And if you don't have enough fluid, then the tissues can adhere to each other, and they form adhesions and connections, and increase friction and cause scarring and adherence of tissues. Now, what is the volume of peritoneal fluid? It's only 50 milliliters, so there's not a lot. So most of this peritoneal space, or in the peritoneal cavity, is actually, it's really small, and there's only a little bit of fluid. So how much is it? Well, there's a can of Coke. That's about it. Diet Coke, that's about it. 50 milliliters or 1.7 fluid ounces of a can of Diet Coke. Now, if you have too much peritoneal fluid, it's called ascites. And so there's normal, about 50 milliliters. And ascites can be as little as 500 milliliters, which is, about a can and a half of Diet Coke, to 1,500 milliliters. And now we're getting close to, you got almost, a little over 4 cans of Diet Coke. And at times, people who have really bad ascites, 35 liters. And so to give you an idea of what this looks like, here's an axial CT through the abdomen at the level of the liver. And there is a vertebra, like kind of some happy faces, in dark there you can see the bottom of the lung. And there's the liver, and then there's the stomach, and bright there's the rib. And there in those red arrows, that gray, that darker gray, is showing this peritoneal fluid just filling that peritoneal space, so it can cause this big swollen abdomen by having that much fluid. Okay, so let's talk about the peritoneal sac. Peritoneal sac is formed by the parietal peritoneum in blue and visceral peritoneum in green, and it's the space between it, or basically the sac is formed by those, and it's filled with peritoneal fluid. Now, here we have in the sagittal section the following. There's our liver, and there's our stomach, and there's the pancreas and the duodenum, and there's the transverse colon, and those other 5 green circles are the small intestine. And then behind, we have the abdominal aorta. And then we also have at the very bottom, in this infraperitoneal space, we've got the bladder, the uterus, and the rectum. Okay, so the peritoneum is shown there in blue, parietal, visceral, and mesentery in this sagittal section. So there's our parietal peritoneum lining the wall. The mesentery, the double membrane coming off that posterior wall, engulfing organs, and there's the visceral peritoneum that's surrounding, in this case, one loop of small intestine in this picture. Now there in light blue, filling this cavity, there's the peritoneal sac that contains the peritoneal cavity, which is filled with peritoneal fluid. Now the peritoneal cavity has 2 subdivisions. The greater sac, which is primarily the majority of the space of the peritoneal sac, and then behind the stomach and the liver is the lesser sac, behind the lesser omentum. So here we have another cross-section through the liver, and then there's the stomach, and there's the spleen, and there's our portal triad at the free margin of the lesser omentum. So in orange, surrounding the wall, is the parietal peritoneum, and in purple is the visceral peritoneum. And then in blue, there we've got this peritoneal cavity that's filled with peritoneal fluid. Now, the peritoneal cavity has 2 subdivisions. The greater sac, which is the majority of the peritoneal cavity, but deep to the stomach, we've got this lesser sac right there. And so basically, the greater sac plus the lesser sac equals the peritoneal cavity. And so the lesser sac is really just this space deep to the stomach and lesser omentum and a little bit of the liver. Now, to this, the communication between the greater and lesser sac is through an opening called the epiploic foramen of Winslow. And it's right there, right along deep to that free border of the portal triad of the lesser omentum. We also call that part of the lesser omentum the hepatoduodenal ligament, which I'll talk about more in a few minutes. So the greater omentum is part of this peritoneal sac, a part of the peritoneum, that is this apron-like fold of peritoneum, and it attaches between the stomach and transverse colon primarily, and it has 4 layers. And so there we have this apron-like peritoneum that drapes over much of the intestines and organs of the abdominal cavity. And it attaches to the stomach here, and then also to the transverse colon there, and together it now makes this greater omentum. Now, anatomists, we like to name everything, and so there's really 3 different parts to the greater omentum. The biggest part is the part that goes between the stomach and transverse colon, hence the name gastrostomach colic colon ligament. Even though it's not a ligament like bone, it just attaches this peritoneum that attaches stomach to transverse colon. This picture doesn't show the gastrosplenic ligament and the gastrophrenic ligament, the parts of the greater omentum that goes between the stomach and the spleen, and the stomach and the diaphragm. And it has 4 layers. So basically there's 2 layers that come from the front and back of the stomach, and 2 layers that come from the front and back where enveloping the transverse colon. So this major part of the greater omentum has 4 layers. In this picture, what we see is the following. There's the greater omentum in yellow, and so there's our stomach, and then it also attaches to our transverse colon that you can see on either side. Now, let's do the following. Let's now outline and remove that part of the greater omentum, and we see these blood vessels that are in there, the gastro-omental arteries and veins. You don't see the veins, we see the arteries of the right and left gastro-omental arteries that supply the greater curvature of the stomach and the greater omentum. And it's also called the gastroepiploic arteries and veins, because this term epiploic or epiplume means to float upon, because the greater omentum, when the anatomists first open up the abdominal cavity, we see this big apron floating upon, or looking like it's floating upon the intestines. And that's why they call the vessels gastroepiploic. Gastro for stomach, epiploic for omentum. Okay, so now let's talk about the lesser omentum. And so the lesser omentum is a double layer of peritoneum that attaches between the stomach duodenum and the liver. And so there is this double layer between the stomach and the liver in this sagittal section, and then it attaches between the liver and the stomach. So let's take a look at a different view here. Okay, this anterior view. So there's our liver, and there's the stomach, and there's the duodenum, and just for orientation, there's the spleen. Okay, and so there I've now added, since the picture shows that the lesser omentum dissected open, there's the lesser omentum. Shing! Now the lesser omentum has two components. And so the two parts of the lesser omentum are called the hepatoduodenal and the hepatogastric ligaments. So that dotted line separates. And so the part of the lesser omentum that goes between the liver and the duodenum is called hepatoduodenal ligament. And the part that goes between the liver and the stomach is called the hepatogastric ligament. Now, why do we make a distinction between these two? Well, that hepatoduodenal ligament houses three very important structures that we call it together the portal triad: the hepatic arteries, the bile ducts, and the hepatic portal veins. We call those three things the portal triad, and they're in the foramen going into the lesser sac. Okay, so now dissolve that out of the way, and we see these blood vessels within the lesser omentum. Those are the gastric arteries and veins going along the lesser curvature. So I think of gastric arteries and veins on the lesser curvature of the stomach, the lesser name for the lesser curvature, and the gastroomental arteries and veins, the greater name for the greater curvature of the stomach. All right, now describe how the female peritoneal cavity is different from the male. All right, to do that, so here basically in a nutshell, the female peritoneum has two openings, and the male peritoneum does not. So here in the female, we see the peritoneal sac, and at the bottom of the peritoneal sac are these two openings. Now in the male, we take a look at the peritoneal sac, there are no openings. And so if we take a sagittal section of that and blow it up, if we look on the lateral pelvic wall, there is one of those openings, okay? One opening on this side because it's sagittal, the other opening would be on the other side. And so if we now take this little section and blow it up, this is what it's going to look like. And we have this peritoneum lining the top of the pelvic cavity, and then there is that opening. It's very small. It's less than 1 millimeter in diameter. And there's a uterine tube, ovary, and uterus to help give some orientation. And there's our peritoneal cavity. Now, in this sagittal section, it's that same space is showing that peritoneal cavity lining. Okay? And so if we now go into here, the female peritoneum has an opening on either side. And there it is. Now, the purpose is for the following. When an egg in the ovary, when the egg is ovulated from the ovary, it's going to burst through the peritoneum into the peritoneal cavity, like that. So now the egg is in the peritoneal cavity, and that egg needs to get into the uterine tube to go into the endometrium of the uterus. And so what happens is the egg moves back into the uterine tube via the opening in this female peritoneum, and now it's in the lumen and is able to go to the endometrium of the uterus. Okay? All right, now what is the innervation of the peritoneum? So here we have this cross section again, and there's our parietal peritoneum. Now notice in yellow is this intercostal nerve coursing within the walls segmentally all the way from, and as well, from thoracic and abdominal cavities. And this intercostal nerve not gives sensation to the overlying skin segmentally, but also is going to segmentally provide sensory innervation to the parietal peritoneum. So parietal peritoneum has somatic sensation via the intercostal nerves. And somatic sensation means pain, temperature, touch, vibration. Key to this is pain, vibration. And so if there's inflammation, it's going to be a sharp, localized pain. And so let's take a look and see if that represents some type of a painful sensation or any type of sensation. Then that sensation courses along the intercostal nerve and goes to the spinal cord. There's also some somatic sensation for the diaphragmatic parietal peritoneum that's different. Because it's more like along the bottom of the diaphragm, that part of the parietal peritoneum. It's far away from the abdominal wall. Its somatic sensation is via the phrenic nerves. And so there's our diaphragm, and there's our peritoneal sac, and the phrenic nerves arise from the C3, C4, and C5 spinal cord levels. C3, 4, and 5 keep the diaphragm alive. So they come down, and they provide motor innervation to the diaphragm, but they also pierce through the diaphragm, and as you can see, goes to the diaphragmatic surface and provides sensory innervation of the diaphragmatic portion of the parietal peritoneum in the house that Jack built. Now, the visceral peritoneum gets its visceral sensation, a lot of these stretch receptors and such, by visceral sensory neurons. Since these are visceral sensory, there is no pain receptors or somatic sensation in these traveling in these neurons. And so visceral afferent neurons, they course along blood vessels within the double-layered mesentery, and then they course all the way back and follow visceral afferents back to the appropriate spinal cord levels or brainstem levels. Okay, let's talk about the peritoneum and its vascular supply. So where's the aorta in relation to the peritoneum? The answer, in the retroperitoneal space. Now, the two-layered mesentery transports arteries and veins and lymphatics and autonomics from the retroperitoneal space into the double-layered mesentery, and then to supply the visceral peritoneum as well as the organs contained therein. Now, define the terms retroperitoneal and intraperitoneal and list the organs that fall under each of these categories. Okay, so where is this retroperitoneal space and what is it? Well, this word prefix retro means behind, and peritoneal means the peritoneum. So we look over here, we go, okay, there's the peritoneum outlined in blue, and in yellow, that's the retroperitoneal space, which is behind the peritoneum. And within that retroperitoneal space are retroperitoneal organs. And so organs are considered retroperitoneal if they have peritoneum on their anterior side only, shing, on the anterior side only, are not suspended by mesentery, there's the mesentery, no mesentery, and lie between the parietal peritoneum and abdominal wall, parietal peritoneum and abdominal wall. So if it lists, if all of these three conditions are met, then an organ is considered retroperitoneal. What organs does the retroperitoneal space contain? SAD pucker. That's what it contains. And so what is that? Well, SAD pucker is an acronym for S, suprarenal glands, A, aorta and IVC, D, the duodenum, second, third, and fourth parts, then P for the pancreas, the head, neck, and body, U for the ureters, C for colon, specifically ascending and descending, K for kidneys, E for esophagus, and R for rectum, duodenum, kildum. Now, I do want to make a mention here that most surgeons do not consider the ascending and descending colon as retroperitoneal. Surgeons, most of them consider these as intraperitoneal because the way they move and within the abdominal cavity is more like an intraperitoneal organ. So even though in embryology and most anatomy texts we talk about how the ascending and descending colon are retroperitoneal, in reality they don't function that way. All right, now what is an intraperitoneal organ? Well, the word intra means inside and peritoneal means peritoneum. So we take a look at the peritoneal cavity and shing, there's an organ inside the peritoneal cavity. And organs are considered intraperitoneal if they reside within the peritoneal cavity, check, and are suspended by mesentery, check. So those are the two factors that consider if an organ is intraperitoneal or not. Now, what organs does the intraperitoneal space contain? The answer to that is salty spurs, or salted spurs. Now, what does the acronym salted spurs mean? Well, S is for stomach, A is for the appendix, L is for liver, T is for transverse colon, and D is for duodenum. The key to this is it's only the first part of the duodenum, that duodenal bulb or duodenal cap, the part that's right after the pylorus. And then the S stands for small intestines, specifically jejunum and ileum. The P is for pancreas, but only the tail, the tip of the tail that touches the spleen. The rectum, but only the upper third. The spleen, as just mentioned, and the sigmoid colon. So that acronym of salted spurs is the acronym to tell you what organs are considered intraperitoneal. All right, so now may I please make a small detour with regards to intraperitoneal organs? So here we have that cross-section again of the abdomen, in blue, the peritoneum. Now let's take a section as if you're dissecting or during surgery, and you open up the abdominal cavity. So now you're looking inside, and you see that organ, and you see the fluid in the peritoneal cavity. Now, remember this fist in the balloon analogy? Well, there's the fist, and there's the air in the balloon. The fist is not inside the balloon. The fist simply pushed in the side of the balloon and is covered in plastic. The intraperitoneal organs are not inside the peritoneal cavity. The organ simply pushed in the side of the peritoneal sac and is now covered in visceral peritoneum. So here's an intraperitoneal organ. There's a retroperitoneal organ. If you follow the fascia within, they're actually in the same fascial planes. When you see an intraperitoneal organ, even when you open up the abdomen, it's not in the cavity, even though we call it an intraperitoneal organ. It's all contained within this sac. Okay. All right, now let's talk about the peritoneum in a nutshell. All right, so there's parietal peritoneum that lines the wall, the mesentery, a double membrane that goes to the visceral peritoneum, and there we have all three. And the behind the parietal peritoneum are retroperitoneal organs, and we remember that as sad pucker. And then within the visceral peritoneum, we have intraperitoneal organs, and remember all those organs as salted spurs, and that, my friends, is the peritoneum in a nutshell. To learn about the retroperitoneal space, we have to review the following things: parietal peritoneum, mesentery, visceral peritoneum, and the peritoneal cavity. So first, the parietal peritoneum in blue is the mesothelium lining the wall of the abdominal cavity. Mesentery is this double membrane of peritoneum that then comes and surrounds each organ we call visceral peritoneum. And then the peritoneal cavity is the fluid-filled space within this peritoneal lining. And we look at this, those are all the structures of the peritoneum. And we ask the question, where is the retroperitoneal space? Well, this word retro means behind, and peritoneal, of course, means peritoneum. And so there in blue is the peritoneum, and in purple is the space behind the peritoneum in the abdominal wall. That's the retroperitoneal space, which contains retroperitoneal organs, and all those organs are sad pucker. Hold that thought. And so organs are considered retroperitoneal if they have peritoneum on their anterior side only. Shing, like that. Organs are considered retroperitoneal if they are not suspended by mesentery. There's the mesentery, no mesentery. Organs are considered retroperitoneal if they lie between the parietal peritoneum and abdominal wall. Those are the characteristics that consider if an organ's retroperitoneal or not. And then what organs does the retroperitoneal space contain? Sad pucker. So this video tutorial is going to be covering the retroperitoneal space, and we'll answer the questions: what is meant by sad pucker? What are the muscles of the retroperitoneal space? And what is the lumbar plexus? Hello everyone, my name is Dr. Morton, and I am the noted anatomist. All right, so retroperitoneal space consists of the organs sad pucker, which is an acronym for suprarenal glands, aorta, duodenum, pancreas, ureters, colon, kidneys, esophagus, rectum, duodenum, chyldum. All right, so we're going to focus on the suprarenal glands, aorta, inferior vena cava, because the other organs have been covered in other tutorials, but we cover them because they're contained within this space. So first, there's our suprarenal glands, and the suprarenal glands were also known as the adrenal glands, because supra means above, renal kidneys, the glands superior to the renals, or adrenals, which are the glands ad on the renals. So they both are synonymous. And so there we're going to blow up a step dissection of this adrenal gland and see that the adrenal gland consists of two things, cortex and medulla. So the adrenal cortex on the outside is there. It's derived from the intermediate mesoderm in embryological development. And there we have our pituitary gland. The pituitary gland produces a hormone called ACTH, and ACTH stands for adrenocorticotropic hormone. And the ACTH, when secreted in the bloodstream, targets the adrenal cortex, hence the name adrenocortico, and it then influences 3 layers of cells in this adrenal cortex, we see blown up. And so the adrenal cortex, because there's so many hormones, is very rich in vascular supply because the adrenal gland is an endocrine gland which secretes their hormones into the blood supply. And so one of those layers in the adrenal cortex is called the zona glomerulosa. And the zona glomerulosa is going to secrete mineralocorticoids like aldosterone that helps regulate blood pressure. We also have this zona fasciculata, which secretes glucocorticoids such as cortisol. And then finally, the deepest is the zona reticularis, and they're going to secrete androgens like DHEA. Okay, then in the middle we have the adrenal medulla, which is derived from neural crest cells. And this because the adrenal medulla really are just unmodified or modified, I guess you can put that way, post-ganglionic sympathetic neuronal cell bodies. They're going to secrete epinephrine or adrenaline. That's what they do. That's where the adrenal gland gets its name. It secretes adrenaline, or you could say where adrenaline gets its name. So the adrenal medulla, if we take a look at, again, that little section here, and we see the adrenal medulla, they're going to then secrete adrenaline, which is also known as epinephrine. Epi means upon, nephros, kidney. Or noradrenaline, which is also norepinephrine. And these are going to be secreted into the bloodstream. And so here we've got, so the adrenal medulla does not have a postganglionic neuron because we'll see the adrenal medulla is a postganglionic neuron. So there we've got the T12 level of the spinal cord, and a preganglionic sympathetic neuron courses out the ventral root, ventral ramus, into the lesser splanchnic nerve, and it courses through the aorticorenal ganglion without synapse, and it goes right to the adrenal medulla. And then in the adrenal medulla, those cells are going to be modified postganglionic cells and postganglionic sympathetic neuron cells, and then what they're going to do is secrete epinephrine and norepinephrine directly into the bloodstream. And then the bloodstream carries norepinephrine and epinephrine to the heart, and then the heart pumps these hormones into the systemic circulation. Okay, so the next in the sad pucker is the aorta and inferior vena cava. And there we've got 2 pictures of one on the left of the aorta and on the right showing, or my left, your right? I never get that right. In red, there's the aorta. In blue, there's the inferior vena cava. And so where is the inferior vena cava and aorta in relation to the peritoneum? Some quick review. And there we've got all the peritoneum. And behind it, we have the aorta and the inferior vena cava. And what happens then is the mesentery is those 2 layers, and it takes all the arteries, veins, lymphatics, and autonomic nerves in the 2 layers of the mesentery, from the retroperitoneal space to all the different organs. So in the aorta, we see that green line that shows right down the midline, and we see that the aorta is just to the left of the midline. That's its anatomical topography. And the aorta consists of unpaired branches and paired branches. So let's talk about the unpaired branches first. The first of which is the celiac trunk that we've covered, which supplies all the foregut. The second is the superior mesenteric artery, or SMA, which supplies the midgut organs. And then there's the inferior mesenteric artery, or IMA, that supplies hindgut organs. For more information on each of those, there's tutorials on these 3 different arteries. Now, there are paired branches that come bilaterally off the aorta. The most superior of the paired branches is called the inferior phrenic because it's on the bottom inferior surface of the diaphragm, phrenic, and it supplies the diaphragm. We have the renal arteries, gets their names because they supply the kidneys, hence the name renal. And we have the gonadal arteries that get their names because they supply the gonads. In the female, they'll stop in the pelvic cavity. In the male, they'll go through the deep inguinal ring, inguinal canal, and into the scrotal sac. We have the lumbar arteries that are homologous to the segmental or supply of the homologous to the intercostal arteries, and they segmentally supply the lower back and lower body wall. And then we have our common iliac arteries, which is the bifurcation of the aorta down at the bottom near the ala of the sacrum. And common means it's going to branch. So the common iliac arteries are going to branch into an external iliac artery, which after going through the inguinal ring will become the femoral artery. And then the internal iliac arteries, which supply the pelvis and perineum. All right, now the IVC, or inferior vena cava, and its branches. And so there we've got the IVC, and there's the midline, and the inferior vena cava is just to the right of the midline in anatomical position. And there we've got one of the first branches is called the inferior phrenic vein, which supplies the bottom inferior surface of the diaphragm, phrenic, or I should say drains it. Then there we have the hepatic veins. The hepatic veins drain the liver. They collect all blood that's supplied to the liver. And so think of those hepatic sinusoids, and the blood percolates through the 3 zones of hepatocytes and the terminal hepatic venules. Terminal hepatic venules will drain into these hepatic veins. Then we have our renal veins. They're going to drain blood from the kidney. And we see right there that left renal vein courses underneath the superior mesenteric artery. Then we have our right gonadal vein that drains the right gonad, testes in the case of a male, ovary in the case of a female. Now take a look at this left gonadal vein. The left gonadal vein is unique in the sense that if we follow this gonadal vein down, what it does is the left gonadal vein drains into the left renal vein and then into the inferior vena cava. So the left gonadal vein does not drain directly into the IVC. And then our lumbar veins are segmental veins draining the body wall in the lumbar region. But there's also these ascending lumbar veins that become contiguous often with the azygous system of veins. Many ways of getting collateral blood supply back to the heart. And then our common iliac veins drain into the IVC, and they collect blood from the external iliac and internal iliac veins. All right. So in sad pucker, let's take a look at duodenum next. And in the duodenum, the first part is intraperitoneal, but the second, third, and then the fourth part, which tugs underneath that jejunum, are all considered retroperitoneal spaces. And so we blow this up a little bit. In front of the duodenum, we can see the root of the mesentery. That's going to see, and between those lines, you see the SMA and SMV. And then we also see here is this transverse mesocolon. So you can see this part of the duodenum is behind both the root of the mesentery and transverse mesocolon, meaning they're retroperitoneal. Next, we've got the pancreas, the head, neck, and body. There's the pancreas. So the head, neck, and body are all retroperitoneal, but the tail, the very tip of the tail that touches the spleen, that is considered intraperitoneal. All right, next we've got the ureters, and I'm going to put the kidneys together since they all go together. So there we've got the kidneys, and the right kidney is slightly lower than the left because of the liver in the way, and the kidneys filter urine. More on that from in other tutorials. And then the ureters are these tubular organs that are going to drain urine from the kidneys down behind and into the bladder found in the pelvic cavity. All retroperitoneal. Next, we've got our colon, the ascending and descending colon. So in blue outlined, that's the parietal peritoneum outlining on either side of where the ascending colon would be located. And then there again, in parietal peritoneum, the reflections showing where the descending colon would be. So if we take now a cross-section through the abdominal wall, as viewed from foot to head, like a radiograph, there we have the ascending colon. And on front of the ascending colon, blue is parietal peritoneum. Now watch. These two areas where the parietal peritoneum is covering and going to be surrounding the ascending colon, Look at that's where it's located. It's retroperitoneal because parietal peritoneum is only on one surface. And then we've also got the descending colon, and there's parietal peritoneum covering it. And these two reflections here and here represent where the parietal peritoneum covers the front of that descending colon. I do want to make a note on this. So even though embryologically the ascending and descending colon are considered retroperitoneal organs, the reality is that is such a thin membrane. It's as if they are intraperitoneal. They move in the whole bit. So surgically, the ascending and descending colon really function like they're intraperitoneal organs. All right. Next, we've got our esophagus. And the esophagus comes in through that esophageal hiatus in the diaphragm, and it is retroperitoneal and then very quickly becomes intraperitoneal when it enters the cardia of the stomach. And then finally, the rectum. And so this picture that you see here does not show it. So let's add this sagittal section through the pelvis of a female. And then in blue, there's our parietal peritoneum. And then there's where the sigmoid colon goes into the rectum. And notice the rectum is behind the parietal peritoneum without any mesentery between parietal peritoneum and, in this case, the pelvic wall. You'll also see the uterus and the bladder, which are considered infraperitoneal organs because they're below the parietal peritoneum. All right, so let's now talk about muscles of the retroperitoneal space. Let's start first with the diaphragm. The diaphragm muscle is innervated by the phrenic nerve, and we've talked quite a bit about that in the respiratory lecture or tutorial. But there are three openings in the diaphragm that go to and from the abdomen. The first is the aortic hiatus at the T12 level of the vertebral column, where the aorta traverses. Then we also have the esophageal hiatus, where the esophagus enters first retroperitoneally and then becoming intraperitoneally, becoming the stomach. And then the caval hiatus at the T8 vertebral level, where the infravena cava pierces the diaphragm and almost immediately goes into the right atrium of the heart. There's our diaphragm. It's what separates abdominal and thoracic cavities. Next is our psoas major muscle that arises from the L1 to L5 vertebrae and then inserts on the lesser trochanter of the femur. This is a big hip flexor and vertebral flexor. Next is our iliacus or iliacus muscle that arises from the iliac fossa and also goes down to the lesser trochanter of the femur. This is a big hip flexor. So together, the iliopsoas musculature, we have the iliacus and the psoas major, and they cross below green, that inguinal ligament, into the lesser trochanter. Below the inguinal ligament, we consider the iliacus and psoas major the same muscle, the iliopsoas. All right, now quadratus lumborum gets its name because it has four sides. 1, 2, 3, and 4. Quadratus for 4, lumborum because it has attachments along the transverse processes of the lumbar vertebrae. And this is a good stabilizer of the vertebral column. All right, so now that we've done those muscles, let's talk about the retroperitoneal space and nerves. And so the lumbar plexus of nerves. So there's a cross section in the yellow arrow of a thoracic spinal cord level, and then there's the ventral root, and then there's the ventral ramus from T1. And then there it becomes, the ventral ramus becomes an intercostal nerve. From here all the way down to T12, those are intercostal nerves, extensions of the ventral rami. But what happens in the lumbar region is that these ventral rami form a very complex plexus of nerves that go to the body wall and to the lower limb. And so there's our lumbar plexus, and that's what we're going to be focusing on. So let's take that and blow it up. And here we have all the different branches of the lumbar plexus coming off. So first, we have our subcostal nerve. Sub, because sub means below, costal rib. And the T12 nerve innervates the body wall muscles and supplies the T12 dermatome. Then the L1 ventral ramus divides into the iliohypogastric and ilioinguinal nerves. I'll show you pictures of that in a minute. Then we've got the genitofemoral nerve that branches off of L1 and L2. We have our lateral femoral cutaneous nerve that comes from L2 and L3 ventral rami. We have our femoral nerve that comes from L2, L3, and L4 ventral rami. And then we have our obturator nerve, which also comes from L2, L3, and L4 ventral ramus. And then the connection to the sacral plexus is called the lumbosacral trunk from L4 and L5. Why don't we do that again, except now in the context of how you'll see it in the cadaver. First of all, so the lumbar plexus in situ. So there we go. First, there's our rib number 12. So there's the nerve below that, the subcostal nerve. And so this is going to innervate the abdominal wall muscles, external oblique, internal oblique, transverse abdominis, rectus abdominis. And then it's also going to supply which dermatome? The T12 dermatome from there to there on each side. Okay? Next, we have our iliohypogastric nerve. And so there's our L1 vertebrae. And so there's the nerve coming below the L1 vertebrae. And the iliohypogastric nerve innervates the body wall muscles, as well as it contributes to that part of the L1 dermatome. Not the entire dermatome, but that part. Then we have, and there's our iliohypogastric, showing it where it is cutaneous field. Then we've also got our ilioinguinal nerve. Okay, there's the L1 level, and then there's our ilioinguinal nerve. And the ilioinguinal nerve is going to course down through the inguinal canal, and it's going to supply that part of the L1 dermatome as shown right there in pink. Okay, ilioinguinal nerve. Next, we have our genitofemoral nerve. And so there's L1, and there's the L2 vertebrae, and black is showing the contributions from both the L1 and L2 ventral rami to form the genitofemoral nerve right there. And the genitofemoral nerve is shown there in that gray area of the cutaneous distribution, and it also innervates muscles of the body wall. There is our lateral femoral cutaneous nerve from L2 and L3. There's one side contribution, and there's another contribution from those ventral rami, and it courses below the the inguinal ligament, and it's going to supply the lateral surface of the thigh. I'm sorry that the nerves are showing the right, and then my cutaneous fields is showing the left thigh. Sorry about that. But that left femoral cutaneous nerve, all the lateral side of the thigh. All right, now the femoral nerve. So the femoral nerve has contributions from L2, 3, and 4. And so there's the contribution from the L2 ventral ramus, L3 ventral ramus, and L4 ventral ramus. And they come together, they go below or deep to the inguinal ligament, and they're going to then supply sensory to the whole front of the thigh, and also the medial part of the shin of your tibia via the saphenous nerve. And it does motor to all the quadriceps muscles, your quadratus femoris muscles, which are responsible for extending the knee or straightening your knee. All right, we now have our obturator nerve that arises from L2 and L3 and L4 ventral rami. So there's our three contributions from those ventral rami. It goes through the obturator foramen and enters the medial part of the thigh. So for sensory, it supplies that yellow area, just a little bit of skin in the medial part of the thigh. And motor, it supplies all the adductors, so the medial compartment thigh muscles that are responsible for adducting the hip or bringing your knees together. So there is our retroperitoneal space, and here is our retroperitoneal space in a nutshell. All the organs found in the retroperitoneal space are sad pucker. The muscles that line the posterior or the retroperitoneal space are the diaphragm, psoas major, iliacus, and quadratus lumborum. And the nerves found within this retroperitoneal space are all the branches of the lumbar plexus of nerves. Thank you so much, everyone. And there's the retroperitoneal space in a nutshell.
Okay po, Dr. Mike, that's about it po. It's the 5 videos already po.
Okay.